Kenyan President Uhuru Kenyatta has vowed to fight what he has referred to as vaccine nationalism. Speaking to British broadcaster Sky in London, President Kenyatta has accused developed countries of not doing enough to share COVID-19 shots worldwide. President Kenyatta says there is an ongoing battle to secure equity for the developing world. This comes after the UK government this week promised to send Kenya about 817,000 doses of coronavirus vaccines.
One of the things that really has shown how unequal this world is has been the kind of vaccine nationalism that we have seen, where we have, and I've stated this openly and severally, worked together, you know, when they were doing clinical trials, when they were doing the research into some of these vaccines, and then all of a sudden we find ourselves unable to access those same vaccines. And this is not just Kenya, it is basically the entire developing world. And I think this is something that really needs to be looked at, because the fact of the matter is nobody, not here in the UK, not in the United States, not in Germany, nobody's going to be safe until everybody's safe. And we need to be able to come up with a way of ensuring that there is going to be equity in the distribution of these vaccines.
Well, let's get more on that story now. I'm now joined by Candice Sehoma, who is an Access Campaign Advocacy Officer at Médecins Sans Frontières based in Johannesburg. Candice, why are we seeing inequality in accessing COVID vaccines between developing and developed nations?
Thank you for having me on your show. I think it's quite a very concerning state that we're in, where we see developing nations, or rather developed countries, having stocked up vaccines in numbers to a point where I think there's a stat that says in the UK, the UK has bought vaccines amounting to about 7 vaccines per citizen. And versus in Africa, where we have vaccinated about 1.5 of our population, that can't be fair. And I think it also speaks to the inequity of our health structure, and also just how developed countries have decided to sort of think inwards and not really be in global solidarity, and ensuring that each and every person in the world, including countries in Africa and low and middle income countries, get equitable access to vaccines. So I think the issue lies with how the countries in the global north have dealt with the situation by bulk buying vaccines, and even now talking about issues around having a booster shot for their citizens, whilst in Africa, very little of our population has been vaccinated. So I think the issue also stems from how there has been inequitable access in the distribution of these vaccines, and not being in global solidarity, ensuring that everyone has access.
And so looking at the wider picture then, Candice, who would you say is to blame for the low numbers of vaccinations across Africa?
Honestly, I can't really pinpoint to who is to blame. I think how the whole global health structure in itself, how it's been set up, I think it dates back beyond COVID, where we have seen continuously how African countries, how their health system, or how their ability to access life-saving medication stems, it's quite historical. So I think it also speaks to how the global structure, health structure has been set up, where it favors the global north as compared to your low and middle income countries. So that in itself is one thing that needs to be addressed and fixed for the future. But also I think in terms of the intensity of COVID in itself, I think we are in a position where everyone needs to be vaccinated, and we are confronted with the situation where we don't have enough global supply. And at the moment, the ability to produce certain vaccine only lies with a very few companies, pharmaceutical companies. What we say is that for us to be able to vaccinate everyone, we need to expand. We need to be able to share or rather, pharmaceuticals need to be able to be in a position to share their IP and know-how to enable other manufacturers to be able to produce so that each and everyone can get access to vaccines. So I think at the moment it's centered in very few pharmaceuticals that they're able to produce, and yet they cannot meet the global demand with their suppliers. So I think there has to be quite a lot of restructuring in terms of how global sort of how manufacturing and manufacturing of these vaccines is done to ensure that each and every or that companies or manufacturers that are in a position to be able to to produce vaccines can actually produce vaccines to increase our supply. But also I think initiatives like the COVAX facility also is another entity where especially in Africa, where a huge number of our countries rely on the COVAX facility, and we know that the COVAX facility also hasn't been great in terms of delivery. So I think they different role players and different things that we can point to why Africa is in a point where they cannot vaccinate. And especially I think considering countries like South Africa that might be in a position to actually purchase vaccines and do have the resources to purchase vaccines, but unable to due to global or other countries, developed countries, buying most of the vaccines, and so therefore they're not accessible. But also issues around supply and not having enough to also to purchase those vaccines.
All right, Candice, thank you very much for speaking to us. Candice Sehoma, who is an Access Campaign Advocacy Officer with MSF, joining us live there from Johannesburg.